Man, you are one pathetic loser.
Blah, 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 blah. See, that's the things that are coming out of your mouth, child. Babbling, insanity, delusions.
Dr. Steve, I hope you're better at prostate screenings than you are at radio screenings, you son of a bitch.
If you just read the bio for Dr. Steve, host of Weird Medicine on Sirius XM 103 and made popular by two really comedy shows, Opie and Anthony and Ron and Fez, you would have thought that this guy was a bit of, a clown.
Why can't you give me the respect that I'm entitled to?
I've got diphtheria crushing my esophagus. I've got Ebola virus dripping from my nose. I've got the leprosy of the heart valve, exacerbating my incredible woes. I want to take my brain out and blast it with the wave, an ultrasonic echographic and a pulsating shave. I want a magic pill for all my ailments, the health equivalent of Citizen Kane. And if I don't get it now in a tablet, I think I'm doomed and I'll have to go insane. I want a requiem for my disease, so I'm paging Dr. Steve. Dr. Steve!
It's Weird Medicine, the first and still only uncensored medical show in the history of broadcast radio, now a podcast. I'm Dr. Steve with my little pal, Dr. Scott, the traditional Chinese medicine provider who gives me street cred, the wacko alternative medicine assholes. Hello, Dr. Scott.
Hey, Dr. Steve.
This is a show for people who have never listened to a medical show on the radio or on the internet. If you got a question you're embarrassed to take to your regular medical provider, if you can't find an answer anywhere else, give us a call, 347-766-4323. That's 347-POOHEAD. Follow us on Twitter at Weird Medicine and at DrScottWM, and visit our website, drsteve.com, for podcasts, medical news, and stuff you can buy. Most importantly, we are not your medical providers. Take everything here with a grain of salt. Don't act on anything you hear on this show without talking it over with your healthcare provider. All right, very good. Don't forget to check out Dr. Scott's website at simplyherbals.net. That's simplyherbals.net. I understand that you're retooling,
trying to figure out a way to keep this thing rolling forward, especially with the nasal sprays.
Yeah.
Yeah, we're doing it. We're going to figure it out, I think.
Okay.
Yeah.
Well, we have the new video studio.
Oh, okay.
Let's produce at least a YouTube commercial.
Sure. That'd be kind of fun.
Yeah. I'm getting reasonably proficient in Adobe, in DaVinci.
Okay.
Resolve. I've got the Pro version. I've got the little mixer controller / editor, quick editor thing.
Wow. That's highfalutin.
I got the camera that Normal World made me buy. And then they went,
yeah, we're closing up.
Yeah. What the hell?
Thanks, Dr. Steve.
But
that's hilarious.
Yeah, so we've got all that stuff. So let's just do it.
So when's the studio going to be close to rocking and rolling?
Today.
Oh, you that close?
Yeah.
Oh, cool.
Yeah.
I'll have to go down and see it.
Yeah, I'm getting ready to put the last touches in today.
That's cool.
So I hope to produce my first, Dr. Steve Presents tomorrow.
How fun.
Yeah. So anyway.
Fun. I knew you were up to some kind of shenanigans over the holidays.
I have a new YouTube channel. It has nothing on it, but it will. Yep. It's at it's youtube.com/@DrStevePresents, and it will just be, documentary style or one-off topic type things. I did a video on borderline personality disorder. I've got one on the difference between light beer and shots of alcohol and stuff like that.
Okay.
So I've got just informative stuff. I'm going to try that. I'm going to give it a year, and if I can't come up with any interesting ideas and can't make it do anything, then I'm just going to give it up.
Sounds fun.
Yep.
I'm pretty sure you've got plenty of ideas coming in.
I do.
Constantly.
And the trick is, so anybody out there who's a writer, I used to give people advice because I write, and I'm published in the medical literature. Mm-hmm. If you want to be a writer, the only difference between someone who wants to be a writer and a writer is that writers actually write. And the way to do that is to force yourself, and this isn't my idea. I got this, I don't know from who. Might have even been Stephen King. I'm not sure. But, I mean, he's an idiot, but he has, he's obviously very successful.
Very successful, yeah.
And has some, good ideas on how to write. But what you do is you set yourself a time to do it, and you sit in front of the computer. And you can't do anything else. You can't play games. You have to sit in front of the computer. You either have to write or do nothing.
Okay.
And eventually you'll start writing. And eventually all the ideas will only come when you're sitting in front of it. You won't be waking up at 2 a.m. and go, I've got this great idea, and forget it.
Gotcha.
All of your ideas will come while you're sitting there.
You're training your brain to...
Correct.
Okay, gotcha.
So that's what I'm doing with this. I've got a specific set of office hours every week, and I have to either produce or I have to just sit there.
Okay.
And so I'm hoping, because I get bored easily, I'm going to produce things.
Yes.
So we'll see.
You do get bored easily.
We'll see.
Oh,
right.
I can't wait
but
to see
we'll
where
have a
this
little
goes, yeah.
performance venue in there too, where we can go in and get Mike Milhorn and people like that, and set up cameras and do an actual performance kind of thing. It might be fun.
It might be fun.
Yep.
Might be fun.
Yeah, I got it cheap, so
That's cool.
the only problem is there's an elevator right next to the place, and it makes a lot of noise when it goes up and down. So we got to do stuff either at night when there's not a lot of people there, or on the weekends.
Okay. Or we'll put us a big old piece of foam over it while we're there.
Yeah, it just that
Mute it.
doesn't
That didn't do it, really.
Nah, not
It's an old
really.
building.
Yeah,
That's cool.
yeah.
I figured you were going to say it dings when it goes up and down. The
No, it doesn't do that. It
Right
just,
in the middle of your show.
It just rumbles. Now, some of that I can edit out,
Sure,
particularly voice. One nice thing about DaVinci, and then we'll get to the stuff people actually listen to us for, it's got a really good voice isolation AI protocol in it. And you can just click voice isolation, and it just knocks out all the noise and stuff. So it's cool.
That's
anyway,
cool.
All right. Well, you got anything?
Nope.
Okay. All right. Well, let's take some phone calls then.
Number one thing, don't take advice from some asshole on the radio.
It couldn't be.
Hey, Dr. Steve. I had a question for you about pediatricians. I am expecting a baby in June. It is now January, so I'm just starting my second trimester, and my obstetrician said that...
One thing I want to recommend, go to drsteve.com. If this is your first, and click on the link that says one-page baby manual. Download it, learn it. It's Tacey and I distilled Karp's Happiest Baby on the Block book. It's 300-page book. I distilled it down to one paragraph because really he had one good idea and then fluffed it out to sell books.
To make it a book, yeah.
You can't make a lot selling a little card with
An index card.
one paragraph on it, right? And then we met with a bunch of different experts and just took notes and then put it all down in one-page baby manual. It's really just basically how to get the kid on a schedule and get them sleeping all night.
Okay.
Okay, well, anyway.
I should start scheduling babies' newborn appointments now. Apparently that's very common for the area where I live. And
Does she mean schedule it for June?
I guess, yeah.
Or do they mean now?
Like now?
'Cause that's silly.
Oh, no, I think for when she has a baby in June.
Yes,
Make it
okay,
now.
I agree with.
Yeah.
You might as well, because some of these people are hard to get into.
Yeah, they're hard to get into.
she also said that some local pediatricians will do an introductory appointment before baby is born
Okay.
to just introduce themselves in the practice and answer any questions.
Hello. Yeah, okay.
So 2 questions for you. My local pediatrician that's very close to my home that a lot of local families use and love is not board certified. And I'm wondering if that makes a difference. What are the benefits of having a board certified pediatrician or not? And is it important? He does have 35 years of experience.
Right.
He was formerly a chief of pediatrics at a local hospital.
Okay, so what that tells me is that this person was board certified, and they just, after 37 years, said,
I'm not
screw
gonna take
it,
that
I'm not
stupid
taking the stupid test
anymore,
again. Because right now, a lot of hospitals require you to be board certified. There used to be this thing called board eligible, meaning that you were eligible to take the exam, but you just hadn't done it. But I don't. That just, board eligible just means you never took the exam.
Mm-hmm.
But I'm going to bet if he was chief of pediatrics, because I'm considering this as well.
Mm-hmm.
If he was chief of pediatrics, he almost certainly was board certified at one point. And you can ask him. Just ask him.
Mm-hmm.
Ask him about it. If somebody asked me, if I decided to forego board certification this time, I wouldn't have any problem with somebody asking me about it.
Mm-hmm.
Now, board certification does impact, hospital privileges in some places.
Okay.
Now, I talked to my credentialing at the health system that I work for, and I said, what if I decided not to, renew my board certification? They said it wouldn't be any problem because I've been there for 35 years.
Right.
So that may be what happened. A lot of these boards, I don't know how the American Academy of Pediatrics does it, but they force you to do these things called maintenance of certification.
Mm-hmm.
So you have to do a certain number of different modules and all this stuff, and it's all online, and it costs money, and it's a way for them to continue to make money.
Mm-hmm.
There is a board called the National Board of Physicians and Surgeons that says all of that's bullshit. It doesn't make you a better physician.
Mm-hmm.
And there's no evidence that it does. And that recertification, all these different modules and tests that you have to take before you take the board exam, that it impacts your ability to take care of patients in a competent manner. It doesn't have any impact on that. So they'll certify people as long as they were board certified once, took the exam, and then have a certain number of CME points every year.
Gotcha.
Continuing medical education points. Because it is a lifelong learning situation. You can't just get your license and then just never advance. So I think it's okay to ask. It sounds like this person is a very popular pediatrician. They were obviously well regarded by their peers at some point. They made him chief of staff.
Yep.
And I'm going to guess that that's just what it was.
Mm-hmm.
I will probably continue my primary specialty because on that one I can take 25 questions every 3 months for 3 years. And my biggest issue is at 70, sitting in front of these crappy computer screens at these testing places. They don't have the best equipment.
Okay.
And my eyes just go blurry after 2 hours of standing and staring at this stupid screen. And it's an 8-hour test.
Oh, geez.
And they put all the x-rays and pictures and stuff at the very end.
And how you can't see
And I can't see shit.
No. That's awful.
So I might let my secondary specialty go and just use my National Board of Physicians and Surgeons version just because of that.
Sure. Makes sense.
But anyway, let's see if there's anything else to our question.
So I would imagine that he's very qualified, but I'm wondering why a doctor would choose whether to be board certified or not.
Yeah, some of it's politics too, because there are people who just say, "I'm not falling for this bullshit." I went to medical school, I did my residency, I got board certified, I passed the exam, and all this recertification stuff is garbage, and a lot of people will forego it. Now, there are consequences to that. this particular pediatrician may not be able to see you in the hospital. You have to ask, because it's always nice if your own pediatrician can admit you to the hospital. A lot of pediatricians now use pediatric hospitalists, where there are people that are only in the hospital and there are people who are only in the office. I liked the old paradigm when my kids were young and got norovirus and were dehydrated. We took them to see their pediatrician. They wrote the orders. They came and saw them in the hospital. That was nice. That was 20 years ago, and in 20 years, a lot of things have changed. And you'll see very often, you'll see a hospitalist that's affiliated with your, pediatrician, but you'll never see them again in the hospital. So you just have to ask. Mm-hmm. If he's old school, he may have a situation like I do, where they said, we don't care if you're board certified anymore. Mm-hmm. You've obviously proven
your knowledge and worth. Yep.
All right.
That makes sense.
So ask him. All right. Okie doke.
Hey, Dr. Steve. This is Adam.
Hey, Adam.
Nebraska. Hey, I'm not a sleepwalker or anything, but I had a nightmare the other night where I was kicking somebody, or kicking to get away from somebody, and it went on, it felt like for a little while. And then when I woke up later on, the bed was completely wiped of sheets and blankets. Everything was on the floor. So I assumed that I had kicked everything on the floor. But I'm not known to be a sleepwalker. Correct. So how can I not be a sleepwalker, but yet that still happened?
Yeah. So when you're asleep, during REM sleep, your body is partially paralyzed for this reason, so that you're not acting out your dreams.
Okay.
And true sleepwalkers, that switch doesn't get turned on fully, and so they'll get up and walk around and, act out their dreams. Liam, my son, used to. Did you ever see that movie Paranormal Activity, where they had the time lapse and the woman was just standing in front of the bed, for 3 hours, just standing there immobile?
No, I don't think so. No.
Okay, well, it was pretty creepy.
Yeah, I bet.
And Liam used to do that. I would wake up and he'd just be standing there like Paranormal Activity. It's like, Liam, go to bed. That's creepy as hell.
How funny.
Well, anyway, so that's the one switch. The other switch is the consciousness switch. So every once in a while, people's consciousness will turn back on, but the other switches won't flip on, and so they'll still be paralyzed. Okay. And they'll still be dreaming. Mm-hmm. So they're awake, but they're still dreaming and they're paralyzed. And these are people who have sleep paralysis or think that they're being abducted by aliens. And the reason I bring that one up is because in his case, the switch, the paralysis switch wasn't fully turned on. Okay. So he kicked everything off the bed. But it doesn't mean that this is going to happen every night. And it's not necessarily heralding the beginning of something new, because I had sleep paralysis. The first time it happened, I think I told this story, I woke up and there was a giant eye floating next to my bed, and it blinked, and I had this kind of weird seizure thing. And then I woke up and it was dark in the room. Whereas before it had been light, I could see everything. Oh, wow. It was just the mental map in my brain. And but I was fully conscious when this was going on, which was crazy.
Yeah.
And I've had maybe 6 or 7 episodes like that in my life. And the rest of the time I'm fine. And it hasn't happened again in years and years and years. So this may be just a one-off.
Okay.
That switch, for whatever reason, something you ate, something you drank, maybe something you smoked, I don't know.
TV show we saw earlier, maybe.
And it caused that paralysis switch to not fully engage, and so you kick the bed sheets off. But doesn't necessarily herald something. Now, I will say there are people who take Ambien, right? Mm-hmm. Zolpidem is the generic term for that, and it's not. And there's another one, Lunesta, and these every once in a while people will do wacky things on them.
Okay.
Different than like Xanax or lorazepam, Ativan, where they start acting out dreams. Mm-hmm. I had a friend, and they would do this thing called Big Sex Night, and they would take an Ambien and then have intercourse. And the wife woke up, and the husband was up on the second floor washing windows on a ladder, totally asleep.
Oh, geez.
People have driven to other towns. Now, when they say totally asleep, their eyes are open.
Mm-hmm.
But when you, quote unquote, wake them up, they have no recollection of all of this stuff that happened. And when that starts happening with those drugs, it never stops.
Okay.
It just gets worse. That's what the shrinks tell me. So it has to be stopped.
Yeah.
This is not necessarily the same thing. But if he was taking one of those drugs, then this may be heralding that he's one of these patients that can't take those drugs anymore.
Gotcha.
Okay.
Yep.
All right. Very interesting.
Yeah, cool.
Let us know, Adam in Nebraska, if that happens again or if you have any other weird phenomena. We'll talk about it. All right.
Hey, Dr. Steve, it's Matt in Charleston.
Hey, Matt.
It's Christmas.
Yes.
So
Hey.
I have some biblical medical questions for you.
Okay.
Number one, if it were to happen medically, how would a virgin birth happen?
Well, okay. Could happen a lot of ways. You can get impregnated without penetration. Now, listen, we're not talking about the capital virgin birth. He's asking today, how could one happen? So I don't want anybody saying, oh, he's talking about, the virgin birth. I'm not.
No.
There are ways you can get impregnated without penetration. Sperm cells are, they're very efficient at seeking out, eggs in a birth canal or in the uterus. So there's that.
Mm-hmm.
So just getting close to penetration, getting some semen around there. But there also is a thing called parthenogenesis, though. Parthenogenesis has not been seen in humans. Let me Google this real quick. It's a form of asexual reproduction where an embryo forms from an unfertilized egg. And it says right here, essentially, a virgin birth, allowing females to clone themselves without a male partner. It's common in invertebrates like aphids and some vertebrates such as Komodo dragons and sharks. It's mostly rare in mammals. It can occur. What? It can occur in humans, often leading to tumor formation like teratomas. Okay.
Mm-hmm.
Yeah, because there's only
half of the
genetic material.
Yeah,
exactly
yeah.
right. So let me see. In humans,
interesting.
Human eggs can spontaneously activate, but usually stop developing or form ovarian teratomas. These are tumors with tissues like hair or teeth rather than viable embryos. Artificially activating human eggs is used in research for stem cells and assisted reproduction. So there you go.
There you go.
What do you think of that?
I think that's pretty fascinating.
It is fascinating. But let's see if he had something else.
Feel free to speculate and get wild.
Okay.
Also, if it were to happen, how would someone come back from the dead? What's your theory on that?
Well, okay, so reanimation, we see that. But then you have to define, well, were they really dead?
Mm-hmm.
So you have to define death. We used to define death as stopping breathing. And then we developed ventilators, so that wasn't it anymore. And then when the heart stopped, that was death, except we have ACLS protocol, advanced cardiac life support, where you do chest compressions and cardioversion and intubation, all that stuff. And about 15% of the time you can bring somebody back from that. So we've defined death as total cessation of brain function. Now, there are children, particularly because they're smaller and their core temperature can drop faster, who have been found at the bottom of an ice-covered lake, who were rewarmed and then brought back, quote unquote, from the dead, when through correct application of advanced cardiac life support in a drowning a cold drowning victim. And sometimes, it can be 45 minutes and they're running around totally normal now. So we have a thing called the diving reflex. Humans have it. Whales have it. Dolphins have it. All mammals have it, which is interesting.
Mm-hmm.
But the whales and the dolphins can slow their metabolism and just slow everything down so that they can stay underwater longer. And humans have it to a certain degree. We'll use the diving reflex in old school cardiology when you've got somebody with a supraventricular tachycardia, a fast heart rate that's not, the ventricular tachycardia, the one that is so dangerous. So the supraventricular just gives you a really fast heart rate, and it can result in complications. But you can take somebody's head and dunk it in ice water and sometimes break that, and it's because of the diving reflex where the vagus nerve kicks in and slows everything down. All of a sudden, the heart goes back into a normal rhythm.
Stimulating your parasympathetic tone.
There you go.
There you go.
Well, there you go.
Hey, I've got something interesting.
So, so are those kids that are at the bottom of the lake, are they dead? Not well. No, they're just, their metabolism is slowed down so much that you can resuscitate them. So other than that, it would have to be some supernatural thing or uploading someone's consciousness to a computer. Once the brain has become irreparably damaged, there's no bringing it back. With current technology.
I've got a real quick thing I looked up. The longest on record that we have, Velma Thomas, West Virginia girl, 17 hours.
What?
Cardiac arrest for 17 hours and came back and made a full recovery.
What what were the circumstances?
Highlighting how extreme hypothermia can protect the brain, okay?
Yeah.
A gal from a Polish woman, 91-year-old, was declared deceased.
She was 91?
Placed in a morgue. In the morgue, 11 hours later, they found her and declared that
she's like, what are y'all doing?
She wanted some tea. She wanted a spot of tea.
Oh, my goodness.
The Lazarus phenomenon, which is where the heart just spontaneously starts again.
Yeah.
Lazarus phenomenon. And in a hypothermia case, a 31-year-old was declared dead for 8 hours and 42 minutes after accidental hypothermia, 8 hours and 42 minutes of being deceased. 17 hours, 8 hours.
See, so suspended animation is a thing.
It is.
These are we could learn from this, and if you can do it for 17, what'd you say, 17 hours?
17 hours.
There's, you could apply enough science to this where we could put people in suspended animation for an indefinite period of time.
But you think about some of the major surgeries that some people will have to go through. They're kind of in a suspended animation.
Well, sure, but their heart's beating.
Of course. But I think as far as their brain being in a suspended state.
Oh, it's crazy.
Yeah.
How do we reboot like that?
Oh, I know, it's crazy.
You shut off consciousness, and you've had a colonoscopy, right?
Yep.
They go, okay, count back from 10. You go 10, 9, and you go, this isn't working. And when you're saying this isn't working, it's already over.
Yeah, and then they're like, no, it's over.
It's like a perfect edit.
Yep, you can wake up now.
10, 9. You know what? I don't think this is. And then you're in the recovery room.
Yeah, no, it's like, no, it's over. What? When are you going to do it? No, it's
I remember
insane.
the first time that happened to me. Because when you're sleeping, I feel like when I'm sleeping, I feel a little bit of time passing. There is that sort of sensation of time passing.
Yes.
But under anesthesia, that is not the case.
Nope.
Very interesting.
Wow.
All right. Let's do this one.
Hiya, Dr. Steve.
Hello.
And Weird Medicine team. How are you?
Good. How are you?
Good.
I'm great. Thanks for asking. Anyway, I have a question about jaw dislocations. I have Ehler Danlos syndrome.
Yep.
So, a little bit, sometimes my shoulder will pop out of place or hip. It does cause discomfort, but mostly the one that bothers me is the jaw.
Yeah.
It clicks constantly.
Yep.
When I sleep, it'll often fall out of place, at least once a week, I would guess, and then lock there. I've tried certain things, but nothing really seems to work. And I heard you talking about Botox for headaches. And I was wondering if that would work at all for therapeutic use for...
No. Okay, so Botox works by... Well, it has several mechanisms. One is it can deplete substance P, which is great for scar pain. People who have scar pain will inject Botox along the scar, and it's a neuropathy. It's a neuropathic pain, and it'll make the pain go away for about 4 months by depleting a thing called substance P. But what it is used for mostly medically is to relax muscle tissue. That's the last thing you need is to relax even more, because she's got Ehler Danlos syndrome. There are several different versions of it, but basically it makes joints more elastic. So using Botox would actually exacerbate this. You can get jaw dislocation. You can get temporomandibular joint dysfunction. The connective tissue laxity leads to these sort of hypermobile TMJ, and it makes it prone to subluxation, which is a partial dislocation and complete dislocation popping out. And so you get clicking, locking, headaches, muscle spasms, et cetera, et cetera. So, the treatment is physical therapy. Seeing a physical therapist and strengthening those jaw muscles, tightening them so that they can't go out. There are splints and mouth guards. There are anti-inflammatories for pain. Every once in a while, they'll do surgery, but it's really just to limit joint movement. You don't want that.
No, that's after the last choice. Yeah. So anyway, you may have to go to the ER. I've had to do that before, where once it dislocates, now the pain causes it to spasm. Yep.
And now it's locked in. You can't get it out. And you basically have to put your thumbs, and you got to be very trusting of the person, but you put gloves on, and you have your hands under the mandible, the jaw, and their thumbs go in to the as far in as you can get them. Right. And then you just press down with your thumbs right there at that temporomandibular joint.
Yeah, you've got your thumbs around the back of the back teeth that you can.
Correct.
Bottom
yes,
teeth.
Very
bottom
good.
teeth on the back.
Thank you. And I'm not describing it well. Yeah. And you just basically, rotate your hand so that the thumbs go down and the fingers come forward on the jaw, and it'll usually pop it back out.
And
sometimes you have to give somebody IV Valium.
Yeah, something to relax the muscles.
Yep.
Yeah.
So
I'm thinking exploring some external splints might be a reasonable thing to keep her jaw in place.
Agreed.
At least a safe, quick option.
All right.
But try some PT.
All right. Very good.
Hi, Dr. Steve. I'm Arthur from Pennsylvania. I spoke to you a year or two ago about this swelling and pressure behind my eyes and nose.
Yeah.
I did get a CAT scan in September, and I found out that I had these 2 abscess teeth, whereby the infection spread from my gums to my sinuses.
Oh, my goodness.
And I've tried so many different things, so many different doctors. My question to you, can this thing spread to my brain and kill me?
Is it? So the question is, I wish this was live so we could ask, is the infection still active? Because any infection in the head, particularly the teeth, can cause lots of different things, including heart disease. So this infection's got to be under control. You need to see an infectious disease specialist and an ear, nose, and throat specialist, an otolaryngologist. You may have already done that. So Arthur, call us back or email me and give us more information. We'll see what we can come up with on this. The brain is pretty well protected from external threats, but every once in a while something can creep in there, and particularly if you get inflammation in the head, it can cause a blood clot to form in the venous sinuses, and if that gets infected, you've got a real problem. So I'm only throwing that out. I think the odds of that happening are vanishingly small, but obviously not zero. Of course, the odds are not zero that Dr. Scott and I will get hit by a meteor sitting here talking about this.
Yep.
Highly, highly unlikely, but
not zero.
non-zero.
Yep.
So email me, drsteve202@gmail.com, and we'll look at. I'd be even happy to look at your medical records, and we'll see what we can come up with. Okay. All right.
We've got one.
Okay. Yep.
If you want to do it real quick before we get out of here. So first of all, McCribs wants to thank you for helping go through the issues with the eyes. Had bleeding in his eyes. He is going to need cataract surgery.
Okay.
He's going to have 2 surgeries in 30 days. Was insane, but necessary.
Oh, the bleeding. Yes. And so they're going to have to do the cataract surgery so that they can get the laser in there.
And Dr. Steve, you were right on track with both.
Oh, yeah.
It was nice. First opinion on what.
Thanks, McRibs.
So
good luck with that.
Seems to be doing a little bit better. He's really grateful for your help. But here's the question. So Crystal Williams, what are the health risks with mold? Recently did a home mold test around my house, and we have some in the process of getting removed, but who knows how long we've been around it and still in it. What
do you think?
I think a lot of it depends on what kind of mold it is, where it's located, and where's the source. If you can fix it pretty quick, you can wind up, if exposure, you can get asthma and some other respiratory disorders, maybe lower immune system.
Let me just give you some red flags for mold scams, because they are out there.
Yeah. Oh, yeah. Good idea. Yeah.
If you get free mold testing and then they propose very expensive fixes, if they're the ones that are going to fix it, if they jump straight to air sampling and not looking at water sources, because that's where mold comes from.
Of course.
A lot of time, like if you see mushrooms growing in your bathroom, which I've seen, there's a whole subreddit on mushroom identification. Mm-hmm. That's a bad sign, because what that means is that there's a leak somewhere that's causing a mold to grow in the wood of the studs of your house, and then now it's making fruiting bodies.
Yes.
That's how, because a lot of molds love to eat wood.
Mm-hmm. That's where you're going to find most of the mushrooms out in the wild are going to be on
dead
dead wood
trees.
stumps.
Or trees that are very stressed.
Yeah.
And when I grow, certain mushrooms, I'll grow them on those wood pellets, the Traeger pellets, because they're not treated. They don't have any chemicals on them. So, I'm growing gourmet mushrooms. Don't worry about it.
Mm-hmm.
All right. So, golden mushrooms or golden trumpets and stuff like that.
Mm-hmm.
All right. I'm saying that wrong. Oyster mushrooms and things like that.
Lion's mane and things of that nature.
Lion's mane particularly likes wood.
Yep.
Likes to eat wood. Okay. Now, if they're using high-pressure tactics or exorbitant quotes or demanding immediate decisions, then that's a scam. My mother-in-law fell for one of these, where they charged her $8,000 to put plastic in her crawl space. I had somebody do it for me for $150. It was exactly the same thing. Okay. If the inspectors are lacking proper moisture meters, because this is about moisture, okay, thermal imaging or relevant certifications, or if they rely on a single insufficient air test instead of a comprehensive investigation, suggesting bleach for mold removal, stuff like that, or promising insurance will cover it, because a lot of them won't without specific riders. So if you're going to protect yourself, hire people who are independent professionals that have bona fides, but find the water source. The real professional is going to find the water source and fix that first. Because there's nothing, spraying stuff on mold or putting plastic up or any of that stuff doesn't do shit unless you figure out where the water's coming from, because mold means water. Now, what does it mean long term as far as mold is concerned? You, like Scott said, you can have allergic reactions to some molds. There are some pathogenic molds, but most of the things that grow on wood in your house are not dangerous to you.
Right.
But you can be allergic to them. I'm allergic to mold. So I get nasal congestion and stuff like that.
You can tell as soon as you walk in a room when there's mold, because a lot of people get hypersensitive to it after they've been exposed to it for a while. There are some, and I've seen advertisements. Of course, I don't know if legitimate or not, but there are some pretty high qualified companies that make mold cleaners, like for bathrooms and things of that nature. Clorox and.
Now, there are some pathogenic molds. One of them is black mold. It's greenish black and causes allergic reactions, rashes, headaches, and it's dangerous to infants. Now, there is another one called Aspergillus, which can cause pneumonia in vulnerable people. Most of these things that cause asthma or that cause infections are causing them in vulnerable adults or children, basically people on chemo or elderly adults, things like that. So, all right. Anything else about that?
No, I believe that's what I would do.
Does that help?
Yeah, let's hope so. Yeah, I would definitely clean that up. Go to your local hardware store and get you some good quality mold stuff. At least get the stuff out of the bathroom. But find out where the source is.
Find where the source is.
And one thing about bleach, be careful with just plain bleach, because bleach is harsh on metals.
Yep.
Sometimes a bleach-free, mold cleaner is a little bit better, just depending on what you're cleaning. Yeah. But try to find out what the source is, because if it's just in your bathroom,
it's
just on walls, then it's the moisture in there. Then you can fix that.
Right. All right.
Good luck, Crystal.
All right. Anything else from there?
No, sir.
Really?
No, it's just. Yeah, McGribbs.
Let's look and see what.
McGribbs was thankful for the thing.
All right.
Oh wow, and Tom had a detached retina also.
Oh, is that right?
Yeah, so we got two of them in the house today.
Goodness gracious. Well, Crystal, let us know about the mold. And Tom Hunt. I had cataract surgery in both eyes. After a few months, I had retina detachment. I had to have surgery. Oh, my goodness. Well, with regard to the cataract surgery, my dad was 80-something, and he had it done. He said it was the greatest thing he ever did.
I bet.
Because it just makes a huge difference. Tom Hunt, 803, became a member of the Fluid family.
There you go.
Thank you, Tom. All right, my friends. Well,
so we'll try to come up with
we've kind of run out of steam here. All of a sudden, we're like, well,
Happy New Year, everybody.
Oh, I forgot to tell everybody about what I got for Christmas. I'm not going to show it, but I'll read it to you.
Oh, yeah.
It says, Dr. Steve, it's a great pleasure to send you best wishes and warmest congratulations on the occasion of your 70th birthday. Signed, M. Carney, Prime Minister of Canada, Ottawa, 2025.
That's beautiful.
This was sent to me by my delightful friend, Cardiff Electric. Thank you, sir. I think he had to pretend that I was a Canadian citizen to get that done. And then Dabble Games is no more, but Myrtle's Game Emporium is, and we're going to have a Myrtle-themed game called Pig Knuckle Pinochle.
Oh, funny.
And there are these different combinations, like if the cousins marry, then Paul comes in, but you can bribe him to let the marriage go on and stuff like that. And we also have Troy Smith artwork. These things are 8 by 12, and they're foam, and you can just stick them right on the wall. His artwork is fantastic, and we'll have the quantifier of scat, the green furry monster, and moon-headed jester, and a few others. So check that out. Just go to stuff.drsteve.com and you can see it there. All right? Until next time, check your stupid nuts for lumps. Quit smoking, get off your asses, get some exercise. We'll see you in, 10 days for the next edition of Weird Medicine. Thanks, everybody.